Let's talk about breast augmentation and the incisions. This is obviously a big deal for patients because people really don't like the way scars look. In the past, there were four places that we would commonly use for breast augmentation incisions: in the crease below the breast, around the nipple, armpit, and the belly button. As salient implants have largely gone away in popularity, so has the incision through the belly button, so we won't really talk about that so much. The other three all remain great choices. Obviously, for different patients, different ones are going to be preferable. Armpit is great for patients that want to avoid having a scar on the breast. Some of the disadvantages, though, is that you're kind of limited in the size of implant you can put in. In general, I try to use an implant that's 325 cc's or smaller if I'm going through the armpit. The other thing is if you're young, it's a distinct possibility that in the future, should you want to change out your implants, you'll still need a scar on the breast to change it out. That being said, it's really a good choice. The crease below the breast tends to be the most popular of our implant choices. It's kind of the most straightforward from a surgical standpoint. We can make an incision that falls in the crease. We can get below the muscle really easily, put the implant in, and there's actually good data that shows that capsular contracture rate is actually lower through that incision. So it's probably the most popular. Around the areola is nice, and if you've got sort of a sharp demarcation between the areola and the surrounding breast skin, you can hide that incision pretty well. For women with lighter areolas, sometimes it's a little harder to hide it. The next thing is, what is a scar going to look like? I think one of the big fears that patients have is, my scar isn't going to look good and I'm going to have a deformed appearing breast. I think for the majority of patients that doesn't have to be the case. If we go into surgery with the mindset that we're going to protect our scar for at least 6 months, maybe even a year after surgery, most of the time we can get an incision that's more than cosmetically acceptable. Protecting the scar means a couple of things. First, it means that we avoid the sun. Now that doesn't mean that you're going to avoid being topless. I'm assuming most patients aren't out in the sun topless a lot right after surgery. But even a little bit of UV light can actually go through your clothes, penetrate through a bathing suit or a standard light shirt, and actually cause some darkening of the scar. It's really important that you have sun protection on your scar at all times when you're outside for the first 6 months. That may involve just regular old sunscreen, or there's actual tapes that are out there that have zinc oxide in it that can actually protect your scars. The other thing is silicone. Silicone-based scar therapies really can make a big difference. So, and what I mean by a big difference is they help the color and the thickness go away faster. There's both ointments and silicone strips that patients use. I think silicone strips tend to work a little bit better, mainly because they're on all the time and they don't require the patient to remember to put it on, but both have a lot of merit. The bottom line is that whatever scar you choose, we can still get a really nice result with a scar that's going to be cosmetically acceptable most of the time. Thanks so much for paying attention. Have a great day.